Hi, I'm Dr. Trembush with Advantage Health and Wellness, and today I wanted to talk with you about pregnancy and chiropractic. It's a really important topic for women that are either pregnant, having children, or plan to, that they understand that there are good natural ways to avoid, prevent, or take care of back pain that commonly occurs during pregnancy. So it used to be that we would go to the obstetrician and tell them that we had some back pain, and maybe they give you some medicine or tell you to just deal with it. But more and more these days, the obstetricians, gynecologists are very trusting of chiropractors. They are now understanding what we can do, why it works, and how safe it is. And so commonly they'll send you to a chiropractor when you complain of back pain during pregnancy. Typically what's happening is that your body mechanics are changing in a way that we're getting stress on the sacroiliac joints, and commonly then the muscles around that lower back and gluteal area that irritate then the sciatic nerve. And so back pain and leg pain is the common symptom that we hear from a woman who is pregnant. It could happen at any time during the pregnancy, typically in the later half is when it's more common. But rather than taking medicines, which we don't want to do, is masking the pain. The baby is going to then be exposed to the medicines. It could affect your physiology in ways that you don't want to with side effects. Let's treat the back pain and sciatica naturally. What we do here at Advantage is we obviously incorporate chiropractic, but we also can incorporate physical therapy and massage or manual therapy. And the combination of those treatments is what has been shown to be the best for most musculoskeletal issues, but very effective for back pain during pregnancy as well. Okay. So again, the sacroiliac joint, which is part of the pelvis, and many times the muscles around the pelvis and hip will pinch on the sciatic nerve, creating that leg pain. Typically it's a matter of loosening up the muscles and adjusting the pelvis to get better alignment of these joints, and we can see relief happen pretty quickly. This is extremely safe for the baby. There are no side effects for the baby. Other things that we'll like to incorporate though would be a custom orthotic, because what happens commonly is that our body is changing during pregnancy, releasing hormones that loosen our ligaments, and we start to see arches fail that ultimately lead up the biomechanical chain and create these pelvic imbalances and then muscle imbalances. So many times we will be prescribing to a woman who is coming in with pregnancy issues, we will give them an orthotic that looks like this. It's custom made for their feet, it supports the arch, and prevents those mechanical problems from happening, which then could last for the rest of their life. Another thing that we might incorporate is a back brace that helps to support the now change of posture. As the baby gets bigger, our weight is carried much more forward, so we want to help to hold that baby weight on the pelvis, not the low back. And a back brace, a simple back brace, we call it a mommy brace, is very effective at doing that as well. There are major benefits to treating back pain during pregnancy with chiropractic that include the safety of it, the lack of medication that needs to be used, but also we can decrease, remove, or manage pain during pregnancy. But I think there are some other important benefits of this as well, which would be maintaining your body's biomechanics throughout life. And during pregnancy is when a lot of these changes can occur. And so we can prevent that while the pregnancy is happening, and therefore prevent pain that could occur down the road of life. But another benefit that I always like for my mommies to understand is that when we are about to have a baby, generally it's better if the pelvis is in good alignment. When we have twisting or torsion of the pelvis, that makes the opening for the baby where they're going to come out be oblique or have stress on it. Therefore the baby can't get out as easily. It could create trauma, or the use for forceps or suction might be increased. And that all could lead to the baby having a struggle of getting out. But if we do have good alignment of the pelvis, which is what happens with chiropractic, the pelvis can open up much easier. The baby and the mommy both have less trauma, less potential need for epidural injections into the spine, a lot less pain and problems afterwards. And most of my moms end up telling me that their delivery time has been reduced from, say, previous experiences with having babies. So if you're having back pain during pregnancy, or you're going to be a mommy-to-be, think about chiropractic and Advantage Health and Wellness. We'll be here to help.